हेलो गुड मॉर्निंग, मैं से डॉक्टर आर्यन और आज हम डिस्कस करेंगे मेडिसिन के पास्ट ईयर क्वेश्चन पेपर. A patient come to the hospital with complaint of lethargy, increased sleep and weight gain. Investigation revealed low plasma T-cells concentration, low T3 and T4. However, on the administration of TRH, the TSH level increase. Which of the following conditions is likely in the patient? Here the hypothyroidism due to disease in the pituitary, hypothyroidism due to disease in the pituitary, hypothyroidism due to disease in the hypothalamus. Here's the answer. Because the patient present with lethargy, increased sleep and weight gain, these are classic symptoms of hypothyroidism, which is characterized by an underactive thyroid gland. The plasma TSH concentration is low, indicating a lack of stimulation to the thyroid gland. Additionally, both T3 and T4 levels are low, which are the thyroid hormone responsible for regulating metabolism. If TRH, thyrotropin resulting hormone, is typically administered to evaluate the function of the hypothalamus pituitary thyroid axis. In the case of administration of TRH results in an increase in the TSH level, this indicates what that the pituitary gland is capable of responsible to TRH by releasing. In TSH, this suggests a problem with the hypothyroidism, which is responsible for producing TRH. And based on the given information, the most likely condition in the patient is hypothyroidism due to disease in the hypothalamus. Next question. A 30-year-old lady present with body pain, easy fatigability and problem with standing. Neurological examination revealed loss of vibration, sense and proprioception. Investigation revealed a hemoglobin level of 7 mg per TL. Which of the following should be administered for the patient? Vitamin B1, C, B12 and D. Here the B12 is administered because the vitamin B12 cobalamin deficiency can lead to the neurological symptoms and anemia, which are consistent with the patient presentation. The neurological symptoms include loss of vibration sense and proprioception and characteristics of neurological complication that can occur due to the deficiency of vitamin B12. Next question. A patient present with a clinic history of a severe road traffic accident. On examination, there are signs of raised intracranial pressure. What would be the most appropriate treatment option for this patient? Administer antibiotic for potential infection. Initiate anticoagulant therapy to prevent blood clot. Perform immediate surgery. Administer mannitol. This is the answer. Because the administer mannitol to reduce the intracranial pressure and management of raised ICP, intracranial pressure, head and elevation to improve the jugular venous flow, and osmotherapy with mannitol, 3% saline and glycerol or astaginomide. Next question. At which level the lesion is located if all extraocular muscle are paralyzed? Frontal, eye field, cerebral surface, midbrain and pons, spinal cord. Here the answer midbrain and pons. Because when the midbrain and pons are affected, the cranial nerves 3, 4, 5, 6, 7 and 8 are lost due to its location. The oculomotor nerve loses its control and hence extraocular movement are lost and hence extraocular muscle are paralyzed. Next question. A 54-year-old man was brought to the casualty with fever, headache and focus seizure. ECG show focal temporal lobe spike. CSF sample analysis show 50% cell with 90% lymphocyte and 10% neutrophil. What would be the drug of choice for this condition? Well, cyclovir, acyclovir, gangliosilovir and foscarnet. Here the correct option is the acyclovir. Because the focal temporal lobe spikes along with the symptoms of fever, headache and seizure indicate HSP meningitis. The empirical therapy of HSP is acyclovir. Next question. A patient come to the blood pressure of 161/10 mmHg and left-sided facial paralysis and weakness since 8 hours. Her CT appears normal. What would be the next step? Observation and monitoring, intravenous labetalol or intravenous thrombosis and oral nifedipine. Here the answer is the observation and monitoring because the patient may be experiencing a transient ischemic attack or an ischemic stroke. Ischemic stroke or transient ischemic attack. Have sudden onset. This is the sudden onset hemiparesis with a normal CT scan. For the patient, observation and monitoring would be the best next course of the action, and the neurological symptoms usually resolve within 24 hours. But if the symptoms persisted more than 24 hours, it is evaluating a stroke. Next question. What would be the most appropriate next step in managing a 40-year-old female patient who is experiencing cold intolerance, dry skin, constipation, and has a slow ankle jerk on examination with a TSH level of 50 and low T3 and T4? Benign treatment with the levothyroxine, major thyroxine binding globally, order a thyroid radionuclide uptake and scan, order thyroid ultrasonography. Here the correct option is the A, benign treatment with levothyroxine, because the above case here we the discuss is that the hypothyroidism, as there are low levels of the total and free T3 and T4 with the high TSH, treatment with the hypothyroidism, levothyroxine 1.6 microgram per kg to be started, available as 25 microgram or 50 microgram or 88 microgram and 100 microgram. If the dose is more than 100 microgram, it increases O2 consumption, resulting in angina. Hence careful titration of dose increasement should be done. So that's all, and keep revising.